All right, you guys, welcome. Welcome to you and welcome to my guest, Hilary. I'm so excited to introduce Hilary. I actually was connected to Hilary through one of my previous guests on the show, Karl, and I'll link to his episode in the notes below this video. But Hilary Lewin is a massage therapist and a doula and the founder of Doula UK. And she is going to speak to us today about the Arvigo techniques of abdominal massage. So she's going to tell us more about that. I actually had a viewer write in to me and ask me if I knew anything about Maya abdominal massage and whether or not it could help with prolapse and incontinence. So I said, I don't know. I know nothing about this technique. I've heard of it, but I don't know about it. So I really wanted an expert who could speak to it, and Hilary is that. So she's going to share with us information about the technique, what it is, how it is used, how it works, and then some practical take-home tips that you can use at home if you don't have a practitioner nearby. So Hilary, I would love for you to just kind of take it away, and we'll chat as we go, but please tell us a little bit about your journey and how you got started with this.
Okay, so we've got 25 minutes, and I talk about this for a week. I do a week's training, teaching, so you've got to keep an eye on the clock when you on the here. So the Arvigo techniques of Maya abdominal therapy, or ATMAT, is the full title. There's other people out there who will be talking about Maya abdominal massage or abdominal therapists, and we're all coming from the same place, and so they're going to be great therapists, but I am going to be talking directly about Arvigo therapy today. I learned it from Dr. Rosita Arvigo, who is a woman from Chicago who ended up down in Central America, where she was an apprentice to a traditional healer, Donna Lichio Panti, and several traditional midwives. So she learned from them some of their work, their abdominal therapy, and the importance of it. These were from people who couldn't read or write, but who were intuitive geniuses. And Miss Hortense, who was the midwife, she ended up talking at some of the really big herbal conferences in the States and big midwifery conferences where it was obvious that her knowledge was nothing short of genius. So Rosita Arvigo, Dr. Rosita Arvigo, she was apprenticed to them, and she brought along with that a Western mind and a Western training. So she was able to take a traditional therapy and then talk about how and why it worked so well within the Western terminology that we understand. So the reason I love this work is that it works on an emotional, spiritual, and a physical level. I can talk to women, and we work on men as well, but we're here to talk about women and prolapses and general pelvic care today. And I can talk to women, and I can talk to them about how it affects them emotionally. We can talk about how it affects them physically. I can talk to doctors, and I can bring it down to, these are the ligaments we're working on. This is why it's so important. So Dr. Rosita was able to bridge the space between traditional medicine and Western medicine and deliver it in a way which is quite literally flying around the world. You know, I will just talk. You're going to have to butt in when you
No, you're doing great. This is wonderful. I'm absorbing like a sponge.
So one of the reasons I think Rosita was chosen was because she was able to be this bridge. And when I discovered this work maybe 15 years ago, there was literally a few hundred therapists in the States doing this work as Rosita teaches it. I got on board, went to the States wondering why on earth I was going there. There was just like one really quite kind of useless little website, but I just knew in my heart that I was following the right dream. And in that time, since I started this work, we now have therapists literally right around the world. So I was very involved in bringing the Institute over to England to do the first teaching outside of the States, and now I teach this work, and I go to Israel, Australia, all over Europe, all over the States. I've been to Japan. We have therapists literally in Dubai, in in several of the Arab countries. We've got a couple in South Africa. So there's areas of the world which we need to go to more. We've got someone in Hong Kong. We've got Russian therapists now. Wow. Literally, this work in 10 years has spread around the world from a few hundred people to, I mean, we're probably only talking about, I don't know, couple of thousands now.
Wow.
But this is nothing to do with marketing or anything clever or budgets. It's to do with the fact that it works. So what is this work?
Yeah.
I have here a couple of handy uteruses.
Oh, I love models. Excellent. Okay.
So we're looking at the uterus and we're looking at the pelvis today. So when we don't bleed, our uterus is between 2 and 4 ounces, and I can never remember what that is in grams. I'm still working old-fashioned, but so that's like a 2-3 ounce uterus. It's about this big. It's the shape of an avocado, and this is the hole, the cervix, which apparently feels like the end of your nose. Not that I've ever really managed to make that connection. I have had my finger up and on my nose, and not really, no similarity. Anyhow, that is your uterus when you're not bleeding. And when you're ready to bleed, your uterus doubles in size and weight. And so this is a 7-8 ounce uterus. So literally, if you were able to feel this, there is such a difference in the weight and the size.
Yeah.
So step one for me when I started this work was going, oh, so my uterus actually is twice as heavy when I come to bleed.
Well, people wonder and ask me all the time about their prolapse, feeling like it changes position during the month. And yes, it does. And this is one reason, is that your uterus is growing heavier and getting bigger. And so yes, things are shifting and changing throughout the month, throughout your cycle. So continue. Yeah. I just thought I'd share that.
So a really, really great way of understanding what's going on is to keep a diary. And we have all these wonderful apps on our phones. I'm in my mid-50s and I'm still sticking with my paper calendar. And I'm moving into menopause, which is a whole other world. But really just keeping a diary of when do you notice the most, when do you most have the urge to urinate? When do you most suffer with constipation? When does your uterus, your pelvis feel the heaviest? And start to work out, is there a pattern? So is there a monthly cycle? Is there activities that make it worse? So the first thing when women come to me and they're talking about any gynae issue whatsoever, painful sex, endometriosis, period pain, all of these things, first of all, let's start by seeing, is there a pattern? Yeah. And so over 3 or 4 months, people chart your condition, whatever makes sense to you, either on an app or on paper or on a calendar, and then work out, bearing in mind that from ovulation, your uterine lining is thickening, ready for that embryo to come down and get embedded, and is getting heavier and heavier and heavier as you get towards your menstrual cycle. So where's my soft pelvis? So here we have a pelvis. And so your uterus sits inside the pelvis and should occupy a really, really specific space. Shouldn't be leaning too far forwards, and neither should she be leaning too far backwards. So if you imagine this is your uterus, this is now a bladder, and then behind here would be the bowel. So as your uterus grows and shrinks and grows and shrinks over the course of each cycle, if she's tipping too far forwards, as she gets bigger and heavier, once you get past ovulation, then she's going to weigh heavier and heavier and heavier onto that bladder, applying more and more pressure. So this woman is going to find that she's got increasing need to urinate. She's less likely to be able to hold her urine for long enough. One of the big things, and I'm sure you talk about it with your clients all the time, is pee with patience. And I have a friend patient, she's always like, do you have to say that? And I'm just like, I'm sorry, we do.
Yes, don't push to pee is just my motto. Don't push to pee, but I love pee with patience. I think that's wonderful.
Well, maybe I'll tell patients I can sometimes say the don't push to pee. That's a good one. But if you think of your uterus, if she's leaning forwards because the ligaments that are supporting her are allowing her to flop forwards, she's going to sit heavier and heavier and heavier on that bladder. And ultimately, that could be part of the cause of some kind of bladder prolapse. If your uterus is tilting backwards, then she's going to be leaning into the rectum. So this woman might find that the first half of the month, she's absolutely fine. But once she gets past ovulation, she's getting increasingly more constipated as the uterus is growing and sitting heavier and heavier. And then maybe 2 or 3 days before her period is due, she'll become completely constipated. And then as the uterus starts to empty and to take that pressure off, then suddenly she has much freer bowel motions.
I have never put this together, Hilary. This is incredible. And I've got to say, I'm going to get open and honest with people here right now, but that little thing that you just talked about, that's me, the constipated issue. But but I have a retroverted uterus. I was told, So, I mean, hello. I guess I just never really put it together. I kind of did, but I really didn't. So thank you. This is fantastic. Continue, please.
I started doing all of this when I was 39, and I have been working as a doula for all those years and a massage therapist. And I knew that my lining of my uterus thickened, but I never realised that actually made for a really substantial weight difference. If I was to drop these two into the gusset of a pair of tights, you'd see this would, really, really, really fall right down. Yeah. So our pelvic floor has to support so much more weight. Then if we add on to that issues of constipation, and so we're starting to get real blockages in there, then the whole dynamics of flow. So Rosita's 2 favourite words throughout our entire trainings that get just drummed into us for every single thing are homeostasis, hemodynamics. So hemodynamics is flow. So we need to have 5 great systems of flow. We need to have the sacrum at the back. So the sacrum, all these little holes, these foramen, these are where all the nerves that innervate the whole of the pelvic floor, the uterus, our ability to orgasm, our ability to have a bowel motion, bladder, all of that come out of these little holes. So any damage that we've had on our sacrum, any falls where you've landed on your coccyx and really, really not been able to sit down for a week, that's interfering with nerve flow. Then we have blood flow. We have the arterial blood. We have the venous blood. We have lymph. And then we have chi or energy, whatever you want to call it. So hemodynamics is making sure that we have the full 5 systems of flow going into the pelvis. And I'll talk about that a little bit more in a moment. The other side of it, so homeostasis, is balance. So we want to have the body in the best possible balance so it's able to heal itself. So homeostasis is making sure the acid alkaline levels are fine, that the minerals in the blood, all of those are working to their best ability. So how do we get good flow is through making sure the channels are all open. If you have a stream, and it's a beautiful gurgling stream, and everything's flowing and light and beautiful and growth and oxygenated, and then a tree falls across that one at the end of one summer, and the water flows around and under, and it's just finding its way, and it's not making too much of an impact at the end of that summer. But then as we go through the winter and all the twigs and the debris and the leaves come down, by the time we get to next spring, there's been a bit of a build-up behind this tree, and so it's starting to flow a little bit more slowly, starting to get a little bit of a kind of a build up behind with some scuzz on the water and what have you. And then we carry on over 1, 2, 3 years. Then we end up with a really dark pool behind and that burbling stream, it's still moving, but it's much more sluggish, and there's much more build up and much more room for growth of all sorts of things. And that's what's happening with our bodies. So that's why we have to listen to the first signs, because if we catch it when it's just happened, we can stop all that toxic build-up happening for whatever reason. So by movement, by the clothes that we choose to wear, by the lifestyles that we choose to have, we can make a big difference to the toxic buildup that can happen in this pelvic bowl.
Okay, so this must be where the abdominal massage, the Arvigo techniques come in addition to the lifestyle practices you're referring to.
Exactly.
So what is it? What does it look like? What do you do?
What's it look like? So one of the things that is that we all promise is that we don't show how to do this, the lower part. I'm going to show you some of the top part, the lower part, because if you have an IUD or a coil fitted, if you have an infection, there's a few times when we don't want people to do this. So we don't just do kind of mass demonstrations, but basically what we are doing is we're working into the pelvic bowl when we're doing the massage, and we're just lifting and helping to bring circulation. And this is what women do if you have a painful period. What are you going to do?
You're
rubbing that area.
Yeah.
So when we're just working into this area without actually kind of thinking about what we're doing, we're improving flow. So everything that a woman does naturally is what we're kind of doing, but we have a little bit more focus on it, which we'll go into in some more detail in a moment. But we are working very deeply into the diaphragm. So the diaphragm is this domed structure. Through the diaphragm comes the esophagus that goes to the stomach, the main artery from the heart, the vena cava on the way back up. I don't know, approximately 72,000 nerves. I read somewhere, I don't know who counted them. But one of the big things about the diaphragm, it also has two little structures that attach it into the mid-lumbar area. So the diaphragm has like two tails that come down into that mid-lumbar area. That is where the ovarian artery arises from. Okay. So any tension in the diaphragm, you're pulling directly into that mid-lumbar area. So that gives you backache. That affects your blood flow to the ovaries. It's affecting those 5 systems of flow getting down into the pelvis. I have here one of these Chinese finger traps. Have you ever played with
I
these?
love those. Yes.
Yeah. So let's hope I can get my finger out.
Okay.
So put our finger in each end and we pull. It gets really, 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 really tight, and you can't actually pull your finger out. So
hold up, yeah.
Yeah, it's like do the rest of the talk. That's kind of what happens when our diaphragm tightens. It tightens right around the esophagus. It tightens right around the main artery coming out from the heart, the vein on the way back up, because each one of those structures, the diaphragm wraps like a figure of 8 around them. So by working into the diaphragm, so by simply putting your fingers into your solar plexus and just taking some time to breathe and doing some, I saw your tracking.
I know. I was just like, okay, I can't go.
I'll show you mine.
Everybody, both of us are wearing pajama bottoms today. Just so you know, pajama bottoms. So I'm gonna own it.
Yeah, own it. So what you're doing is you're working into your solar plexus, and so literally just kind of just letting your hand come down. So you're working down to the belly button, and just literally as you bring your attention to this area, you start to breathe. And you do that, and then you're going to work off your rib cage, and you're working into that central line. And just whatever feels good for you in a way that you're actually, and because I do this so often on a cellular level, the moment I do it, my body starts relaxing.
Oh, that's
so you're just literally working off the edge of the diaphragm through the rib cage and down to that central line. When we start to do that and we start to do our breathing, that relaxes the thoracic diaphragm. That has a direct, it's like a bag, that directly relaxes the pelvic diaphragm. Wow. So when we teach the massage, we're doing massage from the pelvis, we're going from the pubic bone, we're working into this pelvic bowl, but we start by relaxing the thoracic diaphragm, which in turn directly affects the blood flow, the nervous energy, everything that's going into that pelvic bowl.
Well, so this would be wonderful for people with interstitial cystitis or just pelvic pain, sexual difficulties, tension. Okay, this is wonderful. So starting up high affects down low, which of course, I mean, we're completely connected from head to toe, so that makes sense. That's so wonderful.
Yeah, one of the things I really often like to say is if I take this garment and I put a knot in here, you know, you can see it pulls all the way up here, it pulls all the way down, it pulls the whole garment. So wherever we have that knot in our body, it affects literally from head to toe. So any women who have done any, who have birthed a child or have done any of the kind of the birthing courses, we learn about how to, if we relax our jaw and relax our mouth and our tongue, that helps our cervix to open. So we have the dome of the mouth, we have the dome of the diaphragm, and then we have the bowl of the pelvis. And all three of those things are connected. Yeah. So we relax our jaw, that in turn helps to relax our pelvis. So if we have painful sex, if we're anxious about weeing ourselves, if you know, we have anal fissures or something that I was just talking about earlier on today with a client, all of those things are pelvic dysfunction and can happen through birth or through trauma or through lifestyle, but there's so much shame around pain and problems with our pelvis that we just freeze up. And so rather than thinking, what can I do for my bladder? What can I do for my incontinence? What can I do for my prolapse? Thinking about how can I soften myself from head to foot? Because we think if we're looking at incontinence, if we're looking at prolapse, we've got to pull and tighten up. And you know, this is your world. It's about letting go.
It really is. There's so many, it's something that is so counterintuitive because you think if everything's falling out of me, I need to tense up against it. But that certainly isn't causing your muscles to be stronger and more supportive. It's causing them to be tired and just tense and not work well, not be coordinated. So often I'm finding that more and more people are showing signs of significant tension in the pelvic floor, and before they can do any type of you know, strengthening exercises for the pelvic floor specifically, they really need to learn how to let go. So this, I guess, is the answer then to how the Arvigo techniques could really help with prolapse, is actually by releasing. Is that kind of the nutshell version? Okay.
Absolutely it. And so, you know, and we're not just thinking about the pelvic bowl. Let's think about, you know, for us at home who are just going through our lives, just really thinking about noticing when you hold tension in your jaw and knowing that that's transferring right the way down and vice versa. So thinking about the uterus, we call her a she, even though all the Latin languages call her a he.
Why would that? That doesn't make sense.
What that's all about, I don't know. That's another subject. But so we think about the uterus. She's held in place by ligaments. So if we break a bone, it takes maybe 6 weeks to heal. If we damage ligaments, it takes up to 18 months to heal a ligament. And that's why, you know, a lot of people will say you're better off breaking a bone than you know, your Achilles tendon, or because it takes so long to heal. So when we start to do the massage and when we start to think about those systems of flow, we're looking at an 18-month window of improvement, of healing. So our quick fix society, wanting just to fix prolapses, it's just like, generally speaking, one of the big issues with prolapses is we take a long time to report them. You know, women will go through years and years and years and years without actually owning up or seeking help, and that's a tragedy. So, you know, my first thing is talk about it. If you think you have an issue, talk about it, and probably don't Google it, because, you know, Dr. Google, it will just terrify you. But talk to your girlfriends, talk to your mum, talk to the elder women in your kind of environment, and find out what they've got to say, what has helped them. So the quick fix world is like, can't we just take it out or put in a mesh, you know, put a sling in? And we're really finding out that all of those issues are very short-term thinking and bring with them a lot of other problems. So if we're looking at how can we improve the quality of your life, how can we just slowly rebuild the strength? So we're looking at improving the blood flow to the ligaments. We're looking at bringing the uterus to optimal health. We can really help with a lot of the smaller issues that women have. So Arvigo therapy wouldn't cure a stage 5 prolapse. Absolutely not. Women that come to me in the first of 2-3 years of having given birth. So they're generally younger women. They're still menstruating women. I've seen massive improvement. Absolutely massive improvement.
And so is this something when you're really working, going beyond the techniques that you just showed us and really starting to feel into the uterus in that area, is this something that requires a trained therapist to work with, or is this something that women can do on their own?
So the great news is, when I started doing this work, I was one of the first people doing it outside the States. There was only 3 of us who were doing it outside the States, and for various reasons, the other 2 stopped working quite quickly. So for the longest of time, like for 3 or 4 years, I literally had women coming from all over Europe to see me, because, if you have a condition, you will Google it and you will find the way. So I would have women come and see me. I would give them one treatment. I would really help them understand what was happening in their body. I would send them home with the self-care massage. So we spend a good 15 minutes of every treatment teaching you how to do the self-care massage. And then I would probably recommend that they went and saw maybe a pelvic floor physio, or maybe a chiropractor or an osteopath to get some of that. Because if your uterus is held up in place by ligaments and your pelvis is completely out of whack, that's going to be stretching the ligament in one side whilst contracting it on the other side. And so we want to get the pelvis into the best possible balance so that the uterus can then sit in the best possible position. So whilst finding an Arvigo therapist is a really, really, really great start, you don't necessarily have to have long-term treatments with them, because you get taught. And so I had women who would go back to Spain, France, Germany, Ireland, and make enormous changes just through doing the self-care massage themselves, and then understanding how your uterus is attached in. We have a ligament which attaches the uterus to the sacrum. So you've got the uterosacral ligament. It's a really short ligament. But if the uterus is flopping forwards, then that's going to be tugging right onto the sacrum. So this woman, when her uterus starts contracting to empty, she's going to be the one that gets real pain right down here and maybe down around her coccyx. So depending where your uterus is, it will depend on how you experience menstruation, how you experience birth. One of my biggest things that I love to talk about, given half the chance, is how we look after ourselves after birth. So that whole 40 days postpartum, really, your feet shouldn't be touching the floor for anything other than going to the bathroom. I realise that that's nigh on impossible with the insular family units that we live in now. But in Europe, God bless America, you don't do so well there with maternity or paternity leave. But in the UK, we have 10 days paternity leave or partner leave. So most women can stay in bed for 10 days. And I'm like 5 days in bed, 5 days on the sofa. Because how we care for ourselves in that first 3-4 months after we've given birth is going to make a difference to how we experience menopause and whether or not we're going to get prolapses later on down the line.
Do you know what I did after I had my son? It was just a couple weeks postpartum, no more than 2 weeks postpartum. I went for a run. And I knew better. I was a women's health physical therapist. I knew better, but it's hard. It's hard that for us in modern society, and I don't know, I'm an American, so I'm speaking from that mindset.
Yes.
It is difficult to stay still and to take care of yourself. But yes, I agree with you. It is so important. So,
and I think really understanding that it's not about just how you experience here. So breastfeeding is easier, bonding with your baby is easier, not being a kind of like a crazy fraught person is less likely if you sit still. But really understanding that how you behave in your fertile years, especially around birth and if you're having babies, is going to make a difference to how you experience menopause and whether or not post-menopause you are upping your odds for getting some kind of prolapse. So when do women get prolapses? You're most likely to get a prolapse through pregnancy, birth process, post-birth. So, your experience of pregnancy, your experience of birth, your behavior after giving birth. Often women will have some kind of, not often, some women can have some kind of prolapse around that time. And then the next hotspot for prolapses is postmenopausal, as our tissue changes, as our estrogen levels change. But that is going to be really affected by the lifestyle that you had in your previous 30 years. So things like when you bleed and your uterus is twice as heavy, that's not the time to go out running.
Yeah. It's another thing that I'm slowly becoming aware of and actually putting into practice. Before I was aware, but I wasn't putting it into practice because I did develop a mild prolapse after I started that run. My sunshine is a little insane.
Yeah. Just makes it look very beautiful.
Kind of angelic. I'm seeing it as angelic. But no, I think that is something that I wish also that people would understand that, and I wish I hadn't been so driven in my 20s to push through, pregnancy and postpartum, and then also my menstrual cycles. Every time I'm, during my menstrual cycle, my bleeding time now, I am taking a step back, and I'm realizing even a few days before, oh, no wonder I feel so tired today. No wonder my normal walk, which feels so easy, and I'm really pushing it up the hills, I just don't want to, and that's okay. Step back. I'm about to bleed. My uterus is twice as heavy. Yeah, I don't have to, or I can do the walk, but I can do it at a slower pace and just stop and smell the roses. So yeah.
Really, really, really. So one of the things I encourage my women to do is to have a calendar in the kitchen. So if you're sharing your home with a partner or a family, multiple people, is to have a red box around, if you're a regular bleeder and you know when it's going to be, just to put a red box around the 2-3 days, maybe one day before your period and the first couple of days. I'm looking at kind of working mums. It's just like, most of the women that come to me, they're all organic-y, schmanicky, cook it all. And I'm just like, your kid is not going to die if it eats pizza 3 days in a row. Really, you're so green juicing it and, soaking your porridge oats all the flipping month round. If your kid eats pizza 3 days in a row, but you put yourself to bed early and honour your menstrual cycle, you're teaching your sons and your daughters a really great model for understanding how to look after ourselves around menstruation, how, if you're a male, you're going to welcome your female partner's menstrual cycles into your life, how, if you're a woman, you're going to actually say, yes, I bleed and I rest, because we do so much important work when we're doing that resting. That's when we have our best intuition and our best ideas. And so actually having it on a calendar so that everyone can go, okay, so those are the 3 days that mum checks out and just goes to bed at 7. Those are the 3 days that we just, we're going to cook our own food. So really starting to manage our lives around our cycles is the biggest feminist act that we can teach our sons, our daughters, the men and the women about living with a menstrual cycle is, for me, an absolute I'm such a flag bearer for that, because that's what we need for society to come back to balance, is understanding that we have 4 seasons as women. I live you're in Germany right now, you really get the 4 seasons. Mm-hmm. And that's a woman's cycle. We have the spring, we have the summer, which is ovulation, we have the autumn, which is that bit just before we bleed, and then we have the winter, which is when we bleed. And actually working with that, that's how we have such beautiful nature. That's how things grow. And that's how we as women work. And so when we work with the power of that cycle, it's great for all of society. It's not just for us ourselves. And then it's also, we're looking at how we're looking at after ourselves during our menstrual years will affect whether or not we're going to get prolapses and things later on in life as well.
Oh, this has been amazing. I love this talk we've kind of evolved into this talk about openness and acceptance around discussing it too. I know we're not talking about abdominal massage right now, but I think this is really important, and I'm glad we went here because I agree. It's something that we've become even more open in my family about. We're pretty open in my family anyway, but now my son, he understands when it's my moon time. That's what we call it. He knows what that means. He knows that I don't jump on the trampoline with him before or during my moon time. Like, I'm not going to do it. And he is going to be a better husband because of it. He's going, I mean, right now it's not all serious and like, we kind of joke about it a little bit, but he understands, he knows, and he is, I'm proud of myself, to be honest with you, that I am helping to create a hopefully a better man for the future. So I hope more women will take this.
How wonderful that we've now got to a time where we can do that, because in my mid-50s, you wouldn't have told anyone you had your period. When I started my period, it was whispered about, it was a really and we have since then now got to a point where, our children know, and you start your period when you're 13, 14 years old. Your dads can go and buy your sanitary towels for you. Your dad's not gonna, whereas that was not something I would have asked my father to do for me when I started my periods when I was 14 years old. And the fact that your son is growing up knowing about, so he's not going to go to school and then have this shock that, what, women do what? They bleed out their vaginas every month. I mean, how shocking for men to have that kind of introduced to them. And that's something that was happening to their sisters and their mothers. And so now the next taboo is, my next big thing, my drum that I beat, and I could talk about this for hours, is menopause. And so we are the generation, with those of us that are in our 50s and our 60s now, we're the generation that brought menstruation out of the darkness and into the light. And we're now also the generations that are doing the same with menopause. And along with that comes all those conditions like painful sex, like like prolapses, bladder. So what is a prolapse? A prolapse can be a womb prolapse. It can be a bladder prolapse. It can be a bowel prolapse. It all comes from the same place of some imbalance in the body. And it's often about our lifestyles that we've used. It's often about how we gave birth. And so educating ourselves about all the reasons how prolapses can happen can mean that we then choose lifestyles that are less likely to promote them. So high heels, trotting around in high heels, great for when you want to go out for a fancy day, but through day-to-day life, no. Our trainers, it's so great that now women just wear trainers to go to the office and then maybe put on some smarter shoes if that's their kind of job when they're at the office. We just had a case in England where a woman successfully sued her company for telling her that she had to wear high heels, and it's like, oh dear, hallelujah, come on.
Oh gosh, yeah.
How we have a bowel motion. So I'm sure you're familiar with the squatty potty.
Oh yes, I'm a huge promoter of the squatty potty.
Yeah. So, just having a little stool in front. So the position that we have a bowel motion, that's stopping all that pushing. So that's going to help us and getting our children to understand how to do these basic things. So it's about education. So for anyone who's worried about prolapses or who has a prolapse, let's look at the activities that we're doing. Let's look at, how you can promote better self-care for yourself. And in some cases, surgery is going to be the best option. So sometimes a hysterectomy, but there's so much that you can do to support yourself before you actually get to making those decisions. And for me as a therapist, sometimes it's about helping a woman come to terms with making the choice that she's going to have a hysterectomy or she's going to go for some kind of surgery, because that might be the best thing for her as far as she is concerned. My opinion means nothing, but how can I help her make a informed and positive decision and choice? Because we all know that when we go to something willingly and in good faith, it has much more chance of working.
Oh, yes.
Rather than feeling like I had no choice, I had to have that hysterectomy. So really helping women understand how to care for themselves is a really big part of what I do as a therapist. So to find an Arvigo therapist, you can go to the Arvigo Techniques of Abdominal Therapy.com.
Maybe I'll have you send me the best link, and I'll put that in the video notes below for sure. Yeah.
We put that in the notes. We have therapists around the States. We have them around Europe. We've got a good cluster of them in the UK. We've got a really great cluster of them in Israel. And if someone is interested in having the work, then and there's no one in your area, then come and train, because we're desperate to get therapists literally around the world. So for any physios, any massage therapists, this is a really great addition to your tool set.
And I guess to leave people with that one starting place that was so simple, and just that simple down and the side and the other side.
Just releasing the diaphragm and deep breathing. So how can we release the diaphragm? Singing, crying, laughing, shouting, breathing, all those yoga, all those Pilates, all those exercises that are about opening up the diaphragm, but really most of all remembering that actually the letting go bit is we're all about tightening and holding, and actually that's the worst thing we can do for any abdominal health, because every organ needs to move. Our uterus doubles and shrinks, our bladder doubles and shrinks, the bowel empties and fills, the liver is doing this, the stomach is doing this. Every organ in our body needs to be able to move and to dance. And if we're wearing rigid clothing and we've got ourselves encased in a rigid body, then we haven't got that flow, that homeostasis and that hemodynamic. So,
there's a time and a place for everything. It's all about, there's a time and a place for isolated strengthening, but then you must release, because you can't keep clenched all day long or you will be in a world of hurt. And I know that's what you're saying to us. So I just want to make that really clear, that neither of us are saying exercise is bad or fitness is bad. No, it's just, it's about balance, and it's about avoiding the rigidness. Avoiding that rigidness. And if you get high on running, then run your heart out. I love the fact that there's women out there doing, all sorts of triathlons and all of those things. It's fabulous. But just, let that training ease up a little bit around your menstrual cycle. And maybe if you are a professional athlete, maybe, it goes against a lot of what I believe in, but maybe actually, having some kind of hormonal contraception that prevents you from bleeding through that 3, 4, 6 months if you're an Olympic athlete. If you're a professional athlete, then there may be a case for it.
Possibly a better thing to be doing whilst you're in the, and that's a very controversial thing to say. But for the most of us, we're not running any races. We're just running for our own joy. So we can not go and run that 5K on Sunday morning when we've got our period. It's just like, listen to our bodies. But like you say, exercise and strengthening is really important, but it's the letting go as well. It's the 80-20 rule, isn't it?
It sure is.
Good 20% of the time, do whatever you want, but do it with style.
Yes, I love it. What a great place to end it. I think that that's perfect. This is wonderful. Hilary, thank you so much. Is there anything else that maybe you can share about, anything you have coming up, or any last words before
take a look at my website, which is hilarylewin.com. There will be links there to some workshops for training in the Arvigo therapy. The websites that I'm specializing in right now are for menopausal women, and they're called Mining for Diamonds, because just really, really quickly, what happens when we reach menopause is our uterus shrinks down to an almost prepubescent size. And in order to do that, it has to go through some processes of cleaning house before it closes down on the cleanest possible space. And I liken that to, if you take matter and compress it and compress it and compress it, that's how we make diamonds. And so that's what I'm saying. That's what happens with the uterus. It gets shrink, compresses down, and we're making our own inner diamond. So I have a series of workshops called Mining for Diamonds coming up.
Wow.
And I'm just looking at getting some dates in America in October, actually, but the rest of them are in the UK.
That sounds incredible. I love the name, too. So I will have all the links that Hilary is going to share with me and that I'm going to share with you in the notes below. So check the video description for all of those. And thank you again, Hilary, for being here. Thank you, everyone, for watching. And I'll see you next time. Hilary, goodbye. Thank you again.
Bye, nice to see you.
All right. Bye.